At ESMO 2021, there have been several very relevant and interesting results presented in the NET track. First, the SPINET trial, so long awaited, a phase 3 randomized study comparing Lanreotide with placebo in lung NETs. Second, the AXINET trial, phase 2/3 randomized study comparing Axitinib and octreotide versus placebo and octreotide in G1, G2 extrapancreatic NETs. And the third one, the NIPINEC study, a phase 2 randomized trial comparing nivolumab versus nivolumab and ipilimumab in high-grade pretreated NECs of lung or gastroenteropancreatic origin. The SPINET trial was initially designed as a phase 3 randomized study to assess the antiproliferative effect of Lanreotide versus placebo in patients with lung NETs. So eligibility criteria were patients with typical or atypical carcinoids that had somatostatin receptor expressing tumors and were basically treatment naive, although up to one prior line of therapy was permitted. And unfortunately, the study was closed early due to slow accrual, because somatostatin analogs are included in all guidelines without any solid evidence, in particular in lung primaries. So it was finally closed with only 77 patients that did not allow to achieve the primary endpoint of the trial. So they amended this primary endpoint to be the prospective assessment of PFS for Lanreotide treated patients, for patients allocated to be treated with Lanreotide in the ITT population during the double-blind phase period. And this assessment was 16.6 months. The hazard ratio versus the placebo control was over 0.9, and it was not significant, but of course the trial was not anymore powered to properly assess this endpoint, important endpoint. And but anyhow, this is the largest assessment of somatostatin analogs performed in a prospective way in patients with lung carcinoids. They did some subgroup analysis. The effect seems to be larger for typical carcinoids than for atypical carcinoids. But again, these are only exploratory analyses that are not so strong in this context of a small trial. But they are consistent with the fact that somatostatin analogs are more likely to be effective in slow-growing tumors. At ESMO 2021, I presented the results of the AXINET trial. The AXINET trial is a randomized phase 2/3 trial that compares Axitinib and octreotide LAR versus placebo and octreotide LAR in patients with advanced progressive G1, G2 extrapancreatic NETs. And in this trial, 256 patients were included. The eligibility criteria allowed for up to 2 prior systemic treatment lines, but did not permit prior angiogenesis inhibitors. About 60% of the included patients had tumors from the GI tract, mostly small bowel, as suspected. About 1/3 were of lung origin. Above 40% were treatment naive, had no prior therapy, and above 40% had received just one prior line of therapy. So they were recruited fairly early in the course of the metastatic disease. And we presented at ESMO the progression-free survival per central blinded independent radiological assessment, which showed that Axitinib significantly improved progression-free survival. The median was 16.6 months for Axitinib treated patients versus a median of 9.9 months for placebo control. So that was an incremental effect of about 7 months. and the hazard ratio for PFS was 0.71, that was statistically significant. And also Axitinib demonstrated a significant improvement in objective response rate per central blinded reading, with an objective response rate of 13.3% versus 3.2% in the placebo group. Up to 80% of patients treated with Axitinib achieved some degree of tumor shrinkage. In summary, the results presented at this meeting show Axitinib induces significantly and clinically relevant benefit to patients with advanced G1, G2 extrapancreatic NECs in terms of objective response rate and of progression-free survival per central blinded radiological assessment. Safety profile was manageable and in line with what we know about these drugs that are already in the market. And overall survival is still immature, and further follow-up will be needed before we can share this data with all of you. The NIPINEC trial was a randomized phase 2 non-comparative study that was designed to explore the efficacy of immunotherapy in pre-treated high-grade NECs. So they included 185 patients with advanced poorly differentiated neuroendocrine carcinoma of lung origin, but just limited to large cell NECs, or gastroenteropancreatic origin. About 50% of the included patients were lung NECs, about 30% were GI NECs, and about 15% were pancreatic primaries. They permitted up to 2 prior lines of systemic therapy, but prior platinum therapy was mandatory. About roughly 60% of patients were included as second-line therapy, and the rest were included as third-line therapy. And the primary endpoint of the trial was the objective response rate assessed at 8 weeks. And the results were an objective response rate of 7% for the nivolumab monotherapy arm, versus 14.9% for the ipilimumab with nivolumab arm. So none of the arms achieved the pre-specified endpoint of the trial, that was achieving an objective response rate of 15%. Although this response rate was slightly higher for lung primaries, about 18% in the subgroup analysis, and lower for GEP NECs, as expected. PFS was very low, the median being below 2 months for both arms. And overall survival as a median was also low, but I think further follow-up is really necessary to see whether there's any tail at the end of the Kaplan-Meier curve of some small subgroup of patients that can benefit in the long term. And translational studies will be relevant to address whether we are able to identify a subgroup of patients that may potentially benefit better if they exist.